Known for a rich history of tolerance, cooperation, and diversity, San Francisco has risen from the epicenter of the AIDS epidemic to being the leader in successful public health awareness and outreach programs. Today, HIV is no longer considered an epidemic in San Francisco. Strong agency partnerships with syringe access and disposal programs, in addition to numerous other prevention programs, continue to help keep our citizens safe.
My name is Dr. Tomás Aragón. I'm the health officer of the City and County of San Francisco. The Syringe Access and Disposal Program, formerly known as Needle Exchange, is an important public health program to reduce the transmission of HIV, hepatitis, and other viral pathogens in the community. This is an important program that not only has important benefits to individuals, but also the community at large. For example, when a community member comes in for services, they have the opportunity to be tested for HIV and also to be referred for drug treatment. This program's success depends on the strong collaboration between the San Francisco Department of Public Health and the San Francisco Police Department.
The syringe program locations range from fixed to mobile sites and are in the neighborhoods they best serve. There are several sites and they are available days, evenings, and weekends.
We should be aware that the syringe program is a place where injection drug users bring the used syringes and access sterile equipment. Many IV drug users cannot visit a site themselves and may instead have a friend or a partner access the services for them. This person may be carrying many syringes to or from a site because they're getting services for multiple persons. It's department policy not to interfere with these exchange programs, and we do that by maintaining a low profile. But when in doubt, ask a supervisor to respond to the scene to make sure we're following policy. We want to encourage clean needles and prevent overdoses, not discourage them.
Each syringe program site coordinator has an identification card readily available to present to any police officer. These identification cards are printed on bright yellow paper with red lettering. Each program supported by the San Francisco Department of Public Health will have a copy of this bulletin. The following items are paid for by SFDph and provided at the various syringe access and disposal programs and should not be confiscated. Syringes, cotton balls or gauze, sterile water, vitamin C powder, alcohol pads, cookers, tourniquets, biohazard containers, condoms and lubricant, referral and educational information. Syringe access and disposal programs also provide naloxone, sometimes known as Narcan, used to counter the effects of opiate overdose. It's a safe prescription medication that works only if opioids are present in the system.
The items in the kit supplied by the Syringe Access Program are easy to identify, and we don't confiscate the syringes, the alcohol wipes, the naloxone, or what we know as Narcan, or the biohazard waste containers, or the other sterile injection equipment. When we search a suspect, we never confiscate any of the approved items. Naloxone is an important component. It definitely saves lives, and it saves us 802 calls. Though in the United States it's exceedingly rare for disease to be transmitted by needle sticks, no one wants to get stuck by a needle. These simple procedures will prevent needle sticks from occurring. Ask the person, is there anything sharp in your pockets that can stick me? Perform the proper pat-down search. Is that a syringe here in your pocket, sir?
Yes, it is.
Is the cap on it?
Yes.
Okay, I'm going to remove this from your pocket. It's very important that you not move while I remove it. Do you understand that? And do a proper search of their bags and belongings. And of course, always act in a respectful manner. The needles are in the bag, sir?
Yes.
Okay. Are they packaged like you just came from the needle exchange program? Okay, so what I'm going to do is going to go into the bag, and just for my safety and your safety, just see if there's anything sharp in here. Is this what you brought from the needle exchange, sir?
Yes, sir.
If you do get a needle stick, notify your supervisor immediately. If you find a needle on the ground and one's brought to your attention by a citizen, handle it carefully and dispose of it either in a sharps container or the bio bucket back at the station. This bulletin will clarify the program locations and times, but be sure to refer to it regularly as the information can be updated often. It's vital to the success of the program that people are not inadvertently disturbed by a high police presence during times of operation.
At the program sites, the biohazard buckets decrease the chance of needle sticks in the field and encourage proper needle disposal.
Without the needle exchange programs, we're more likely to see dirty needles in the streets and in the parks. Nobody wants that, and certainly nobody wants to get an 802 call because they couldn't help prevent an overdose. These programs work, and it's definitely our job to support them.
The syringe access and disposal programs in San Francisco have been enormously successful. You can help by following these easy guidelines. Don't stake out syringe access and disposal sites. Even the presence of a police vehicle at the site can have a negative impact on client usage. Don't make arrests for carrying or impound needles or any other part of the kit provided by the syringe access and disposal programs. Syringe access and disposal programs are legal. We do not interfere with these services.
I want to take a moment and talk to you about the city's Syringe Access and Disposal Program, a critical piece to the city's harm reduction policy. As you know, our job, along with DPH and our other city agencies, is to keep San Francisco safe and healthy. By being proactive with the Syringe Access and Disposal Program, we have had a positive impact on our community by lowering crime, as well as reducing the rate of overdose and the spread of infectious disease, including HIV and Hep C. Public health and public safety go hand in hand, and through interagency cooperation and partnership, we are saving lives and reducing the spread of disease. Saving lives and reducing disease is something that's better for everyone. Be safe out there.
If you have questions, please contact SFDpH Coordinator Eileen Loughran at 554-9124.